Just how we do case acceptance, because it's really different than what other people have taught you to do. And like I said, in dental school they don't teach case acceptance. They say they do, but really it's case prevention for the most part, if that makes sense. So we're going to talk about case acceptance today and what that really means and how you can improve it in your practice. Okay? Here's again a quote from Robert Kiyosaki: "If you cannot sell, you have very little control over your income." Some people freak out when I use the word sell. They have all these common excuses like, I don't want to be pushy, I hate selling, I don't want to sell patients things they don't need or can't afford, and I'm not a salesman, I hate salesmen. Most of the time, when we think of selling something, what's the first thing that comes to your mind? Cars? Okay. Isn't it funny that everybody always thinks of cars? Why do you think of cars?
Used car salesman.
Used car salesman. Okay, exactly. Oh, one other thing, Don, can you help us out with this? One other thing that we forgot, we have a microphone ball, and basically when you have a question or comment, just raise your hand, and then whoever has it will throw it to you. You're not going to hurt it. Some of you might get hit in the head, but just, whatever. And Don, you want to test it to see if it's on right now? Okay, it will sync in just a minute. All right, it stopped syncing. It's not supposed to do that, but maybe we could take the microphone off. If you can open that thing in the top, that would be great. Yeah, just twist it. Okay, all right. Now there's a microphone in there if you want to pull that out. All right, it's hooked back up again. Just whatever you did. Go ahead and put the lid back on, and then we can use it that way. You don't have to hold it up like this. If you'll just set it on a table in front of you, it should work out. And again, don't freak out. Don't stop asking questions because we have you on the microphone. It just helps everybody hear a little bit. All right, used car salesman, pushy. What else comes to mind when you think of selling dentistry?
Coercion.
Pardon me?
Coercion.
Okay, coercion. All right, how so?
Fear.
All right. All right, go ahead. Yeah, hand the microphone to Jack there. All right, she said coercion, and we're going to ask how do we do that?
Well, we don't do that.
Oh, you don't do that, but how did you used to do that? All right, how did you used to do that?
Well, by telling the patient what they need.
Okay, by telling them what they need. Okay, exactly. All right, Jack, you were going to comment?
Fear-based. If you don't do this, this is going to happen.
Okay, so in other words, if you don't do this, whatever it is, you're going to need a root canal or something like that. Okay, all right, absolutely. So, heaven forbid we sell something. Okay, here's one of the secrets. When people walk into your office, do they want dentistry? Okay, absolutely. If not, why were they there? Do they walk down the street and just kind of come to your office and say, wow, what's this? Never seen it before. Do you mind if I look around? Okay? It doesn't have anything to do with that, all right? It's that they have actually planned, most of the time, not always, but most of the time they have called you and requested an appointment. In other words, they want something from you. They really want something from you. So you've got to kind of switch that mentality. And the other thing that I find that gets in the way sometimes is the whole money thing, is that we are afraid that they can't afford it. All right, let me ask you a little bit of a secret here. Have you ever, in a sales situation, told the person you can't afford it when really you probably could? Why do you do that?
Better price.
All right, yeah, you want to get the heck out of there, right? One of the things that I learned at one of the seminars that I went to, a whole series of seminars, was educate the patient, try to be pushy on them, I did all kinds of case acceptance slides. I had a whole bunch of slides, and I had, basically at that time everything was gold. That was the best thing you could possibly use, but it was just kind of a forced kind of a thing. You just have to do that. And so what ended up happening, interestingly enough, was on the last day, they had us come up and do case presentations to each other. And they chose me and another guy, another dentist. He was going to play the patient, and I played the role of the dentist. And so I went up there, and in about 5 minutes, the patient, the other doctor, said, "When can we get started?" All right, and I said, "Well, let's go ahead and look at the front desk and see how quickly we can get you in." And so that's what ended up happening, and he was ready to go after just a few minutes. And the instructor said, no, wait, you forgot to educate the patient. And I said, "Did you hear what the patient said?" "Well, yeah." I said, "They said yes. Isn't that the goal?" "Well, time for a break." Okay? And really what I did after that, interestingly enough, I just said to them, I said, "How many of you, out of 25 people there, how many dentists flossed your teeth last night?" Okay, what do you suppose the number was out of 25 docs? All the doctors are going, "Oh, gee." Is there anybody in this room that's overdue with their cleaning? All right. Anybody in here have restorative dentistry that needs to be done that hasn't been done yet? All right. Well, I'm going to tell you just what I told them. There were 4 of them, actually, that were admitted that they hadn't flossed out of the 25, and 2 of those were lying, all right? And they were just so afraid that, the peer pressure was going to get to them. So there were really about 10% that had done that. So I told them this. I said, tonight in my bungalow at 9 o'clock, I have some slides, and we're going to go over the benefits of flossing. Okay? Because apparently you're not educated, right? They're not educated because all educated people floss. And people that are educated about dentistry, and so in the hygiene department and other areas, we stress the importance of how people should clean their teeth. Anybody get frustrated, again, to the hygienist, anybody get frustrated that the same people that come back sit down, and before you even start, what do they confess? I haven't been flossing, okay? What's that?
Like I should.
Yeah, like I should. I haven't been flossing like I should. And what does that mean?
Never.
I said once, and my son sent this to me, there's a picture of a teenager in the dental chair, and the caption said, "What do you mean, when was the last time I flossed?" Dude, you were here. All right, so that kind of happens. The other thing that I find that happens with hygiene is they walk in and they have flossing injuries. Okay, because they flossed on the way up, they go, "Oh crap, I better do this pretty quickly and make this happen." So those are the kinds of things that we have created that cause people to, the reason we hate this. Are we trying to sell flossing, for example? Are we trying to sell restorative dentistry? Are we trying to sell prevention? Yeah, we are. But the problem is we've been doing it exactly wrong. Okay? Now, I'd like to go over some of the biggest blunders that we as dentists make in selling dentistry. And we've inflicted this, unfortunately, on our team. Okay? The first blunder, which I think is really important, is it's not about you. Okay? Now, that's a little bit of a different kind of approach. And I know that you don't walk in thinking, well, this is about me, because it's not. But still, just think of how the conversation's going. Who's in charge of the conversation when we have this kind of an attitude?
You.
Yeah. We are in charge of the conversation. All right? We talk to them. We tell them all the things that are wrong with them. The analogy that I use sometimes is, how would you feel? Well, anybody here had any plastic surgery? Okay, some of you have. All right. There's some that need it. That maybe, we have a special loan deal that you can use. We had a hygienist once, and I hate to tell this story, but she was a lovely, lovely person, but her nose was about out to here. And unfortunately, you could actually see her come through the door before she came. And did I say that out loud?
Wow.
Anyway, she took her son to have some sort of work done at the plastic surgeons, and she said, "Oh, by the way, what would I do to fix my nose?" So what the surgeon did is he went into all the detail of how they go in and break your nose and all that kind of stuff. Do you suppose she ever had it done? No. Okay. You don't want to do that. The plastic surgeons that are good are sort of like orthodontists. Orthodontists say, "Wow, you have a beautiful daughter, and when we finish, she's going to be even more beautiful." Okay, they don't get into brackets, eyes, or wires, and all that kind of stuff. That's what they do. And so, anyway, that's kind of typically what we do. Now, what story was I just telling before I started this?
It's not about you.
All right, it's not about you. All right, you're going to a plastic surgeon. Can you imagine the plastic surgeon coming in and the dental nurse comes in, or actually the nurse, not dental nurse. The nurse comes in and she said, "Okay, why don't you put one of these on?" It's one of those little gowns that you never know where to tie and it's hanging out. And so they do that. And then the doctor comes in, has a mask over here on the side, and also big loops. All right, and he asks you to lie down. And he starts at the top of your head, and he says things like, "Hmm." And then he asks really brilliant questions like, "Do these kind of hips run in your family?" Or, "When was the last time you had liposuction?" All right? Think about the same thing that we do. All right? So we have them lie down, and he would go over every little inch of your body and get to the bottom and have a list of things that were wrong with you, and then say, "Flip over." Okay? And then do the backside. All right? Now, the backside's a problem because you haven't seen it. You have no idea what's back there. I saw Jerry Steinfeld once, and he was doing a stand-up deal, and he said, as people, as human beings, he said, we have the cleanest chests in the world. Because what do we wash all the time in the shower? We wash our chests. He said, why don't we wash our backs? Why don't we wash other parts of our body as long as, like that? But anyway, they go over the back side of you, and they make a list of all those things that are wrong with you, and then they say, "Okay, here's the list. All right, here's the list. We think you should do all of these, and if you don't, you're going to get even more ugly." Right? All right? So if a dentist were a plastic surgeon, that's sort of how it would go. We'd look at all the things that are wrong with them and make a list of those. Now, I just had some of you know that I had my nose redone, partly because I didn't know that I couldn't breathe. In high school, I never ran long distance, partly because I couldn't breathe too well. And I didn't know it at the time. And then I had a 3D x-ray taken a few months ago, or that was probably a year and a half ago. And the radiologist looked at it and says, "My gosh, you have a really severe deviated septum. Why don't you get that fixed?" And so I thought, well, maybe I should. So I went in, and this guy was really good because he knew how to talk to me. He was a facial plastic surgeon and an ENT. He got both degrees. So this guy was, old because he'd been to school for so long. But anyway, he went in and he didn't tell me exactly what he was going to do, other than we're going to just straighten things and make it so you can breathe. It's amazing. I can breathe. I can go upstairs like that now. And anybody ever had a deviated septum fixed or anything like that? A couple of you have. It's amazing, isn't it? You just kind of all of a sudden breathe again. My food does taste a little bit differently, or different, but anyway, overall it was fun. But he did not give me all kinds of details, even though I'm a dentist. Okay, he didn't give me a whole bunch of details about what he was going to do. And then I talked to a dentist after I'd had this done, who was in the military, and they had, one of the things that they did is in their rotations, they would go watch ENTs work on noses, and he said the first thing they do is they take a big hammer and they go, whack, like that, and it just busts everything, and then they go in and they fix it up. He said, I would never have that procedure done. So I'm glad that I didn't have it done. But that's sometimes what we do. It's about us. We tell them what we think is important. I remember I had a lady come in that was just very well put together. She was a pretty lady and had, you know, the hair and nails and clothes going big time and makeup, and everything was just kind of perfect. And she sat down and I said, may I help you? And she said, yeah, I have this cavity. And I said, okay, do you mind if I tip you back? And look, so I tipped her back. In there, I saw the worst crooked teeth that I'd seen for a week. They were just all like this. And there was a little tiny black spot that was probably pepper that I took my Explorer and just took it off. And she goes, wow, the cavity's gone. I go, well, yeah, that'll be $300. No, I didn't say that. But the thing that was interesting, I said, tell me about, you know, your life and what do you do and how important is your smile to you? And she goes, oh, my husband loves my smile. I was going, he does? All right, has he been to the eye doctor recently? No, I didn't want to say that. But you know what? To her, it was great. It was fun. They were pretty white. I think she'd had some bleaching in the past, but that was okay with her. That's what she wanted. And I didn't go into Invisalign and veneers and all that kind of stuff because that's not what she asked for. That's not what she did. All right? Now, so again, that was about me. That was my opinion on that. All right? Different ways to say that. All right? We talk too much and listen too little. Staff members, actually, doctors, close your eyes for just a minute. All right? If you wouldn't mind closing your eyes. All right? Staff members, how many of you feel like your doctor talks too much? Okay, it's unanimous. The only people that didn't raise their hand were the doctors that don't have team members here. Okay, so obviously they don't talk too much. All right, so here's the thing about it. Here's the ratio. Patient gets 4 words, you get 1. Okay, patient gets 4 words, you get 1. Okay, all right. Why would I suggest that?
They talk themselves into treatment.
They talk themselves into treatment, basically. Okay? Yeah, that's right. You know, have you ever been to a social event where you met somebody and they just talked about themselves? It's pretty exciting, isn't it? And you walk away and just, you know, boy, do I want that person as a friend? Probably not. But if you talk all the time and they ask you questions, you walk away saying, that was the nicest person. I just love her. Okay? It's just one of those human interaction things. So we need to talk less and listen more. All right, now, as we talk about imposing our value system, the bottom line is this. We really steal ownership from the patient. Okay? We steal ownership from the patient when we tell them what we would do. And I love the thing that we learned in dental school that says, you know, I say, say to your patients, well, if you were my aunt, or if you were my brother, this is what I would do. Or if this were my, mouth, this is what I would do. And patients ask that sometimes, do they not? They say, well, what would you do? Right? Okay, what's the appropriate response? Well, Mrs. Jones, what's most important is what you want to do. And let me help you get that. And if you're going to make a mistake or do something that I don't agree with, I promise we'll talk about that. Keep them in the driver's seat. That's what you want to do. And the patient oftentimes is a little resistance because either you or some other dental office has trained them to get in and just rely on your idea, what you would like to do. All right? Now, the other way we steal it is because we use the word need. Okay, starting Monday, nobody gets to use the word need anymore. All right? How difficult is that going to be for some of you? A little bit? Okay. Yeah, it's hard to not say the word need. You need this, you need this, you need a root canal, you need a crown, you need some fillings, you need your teeth cleaned, you need perio treatment, whatever. The person is not in need. Yesterday I talked a little bit about how I had a patient in dental school actually that had no teeth. She had she had about 4 or 5 teeth on the bottom. She had a lower partial, upper denture. She came in and said she needed a new one. And I looked at the denture, looked at the partial, and they looked brand new. No wear, no staining, no nothing. And I said to her, I said, wow, these look brand new. Do you use them? She said, oh, absolutely not. She said, I keep them in a little drawer right by the front door, and anytime the doorbell rings, she just says, I go ahead and put the The denture's in, and I greet, I talk to the patient, etc., and we have a good time. As soon as they leave, I rinse them off, put them back in the drawer. Okay, and I said, well, do you have trouble eating? No. I said, is there anything you can't eat? No. I said, what about steak? No problem. Chicken? No problem. She said, the only thing I have to alter just a little bit is I have to quarter the apples so I can eat those. I can't bite into an apple, which I thought was interesting. Now, Daryl Robertson isn't here, unfortunately. Daryl, if you're watching, we love you, but he actually had a person come with a denture. It was a daughter, and her mom came with her, and she had an upper and lower denture, and they said that they wanted to get their dentures checked. Well, he looked at the one and, with the daughter and said, well, it seems to be fitting okay. What problems are you having, etc. And then when he turned to the mom, she said, here, and the daughter gave her the denture, and they were actually sharing the denture, okay? So that they could save money. All right? Isn't that exciting? All right? Yeah, that didn't work out. But the need work just kills it. It just kills it, because what happens is we steal ownership. All of a sudden, we're taking charge, and we're telling them what they need to do. They need a crown. They need perio treatment. All those kinds of things is when we do that, we steal ownership and bring it back to us. Now, I will tell you that sometimes you might be even comfortable with that, because that feels what you're used to. Feels like what you're used to. And so you have that ownership. You're in charge. You're in the driver's seat. You're the doctor. And so we, again, use the word need to try to motivate the patient. I always love to use teenagers as an example. Anybody either raised a teenager or been one yourself? Okay, mostly. All right. How does it work when the parent tells the teenager, you need to do this? You need to dress more modestly. You need to wear less makeup. You need to cut your hair. You need to clean your room. Okay? Whose idea are all of those? Yeah, mom's or dad's, exactly. That's exactly right. So, try not to use that. Well, don't use that. And sometimes patients will say, well, what do I need? What do I need? How do you answer that? Any ideas?
Depends on what you want.
Depends on what you want. Okay, exactly. I even sometimes I'll say, listen, everything that you have going on in your mouth, you will not die from. Okay, so we kind of get that aside, and I'll say, you don't really need to do anything. How important is prevention to you? Well, it's important to me. All right. So if we could come up with a way to plan to prevent things from getting worse, how would you feel about that? Now, all of a sudden, can you see that they're in charge? As opposed to us saying, well, if you did this and did this and this, and we could do this, and you need this, then we'll get you to where you're nice and healthy. And the patient isn't involved in that whatsoever. Okay? All right, we make it all about us. I try to talk about that for a minute and try to convince them what we think is best, that our viewpoint is the right one. All right? Now, how do you handle second opinions? I love second opinions. Don't you love second opinions? What do you do? How do you have a successful second opinion? Any ideas? Okay, have a planning appointment, but how do you what's the verbiage? What's the mentality? Where are we coming from on that? Because sometimes you don't get to that point, unfortunately.
Could be a shopper.
Okay, could be a shopper. Okay, so how do we handle that second opinion? All right, here's the deal. You can cheat. You ask them what happened at the last dentist and why they were looking at a second opinion. And what does the patient tell you?
Tell you what they've already been told and what they didn't like.
All right, exactly. What they didn't like about something, that's exactly right. So what do you do? Duh. All right, yeah, you don't talk about whatever it is they like. Now, the thing that's fun for me is most of the time we diagnose more, our fees are higher than the last person that they came to. And they said, one of the things they said, well, they're too expensive. Okay? But the deal is you just turn around, and when it's the patient's idea, when they are in charge, it's not too expensive. Because they have chosen that. See, when you go to a car dealer, back to the sales pitch kind of thing, when you go to a car dealer, first of all, they don't have Mercedes, Cadillac, Ford, Kia, and Yugo. They don't have that. Now, sometimes we try to be all things to all people, but anyway, some of you remember the Yugos, right? My daughter came home from 3rd grade and she goes, "Dad, what do you call 2 people in a Yugo?" I don't know. We go. Doesn't that sound like a 3rd grade joke? It totally does. Okay, so they don't do that, but what they do is they find out a little bit about what it is you want to have. What do you want in a car? I remember when I was young and rich, I went to a Mercedes dealer and I thought, I'd like to get a Mercedes, and the guy was, asking me what I was looking for specifically, and so he showed me a car, and I asked this question. I felt really stupid. I said, "So what's the gas mileage on this thing?" And he said, "Sir, if you have to ask about gas mileage, this is probably not the car for you." Yeah, if you're concerned about how much it costs to put gas in this thing, it's not a good match. But I love the fact, frankly, he sort of insulted me, but at the same time, he kind of made me think a little bit, okay, is this what I want, or was I just making conversation? And I can tell you that I was just talking. I didn't really care about gas mileage. It wasn't that big of a deal to me, or, I wouldn't have been shopping for one. By the way, I didn't buy it. Charlotte walked out with a Yugo. No, I'm just kidding. Okay? But we impose our values on other people. We tell them what we would do, what we think is best, all right, as opposed to giving them a choice, okay? Then number 4, this is always a trick question, and those of you who have been with me a while know that this is a trick question. Which comes first, the exam or the sale? The exam, right? I mean, or is it the sale? The sale. Okay, I will tell you that we've all been trained to do the exam, make a list, and tell the patient what they need. All right, that's exactly the wrong thing to do. Okay, the right thing to do is to sell the case or sell the treatment. Okay, again, you have to look at when does a patient buy what you have to offer? When do they buy it? Okay, before or after the procedure? Yeah, they always buy it before the procedure. In fact, like I said yesterday, we have patients that come from Kansas, for example. Well, they buy it before they get in the car and drive 10 hours. Right? When they come in, we don't have to sit down and say, well, let's take a look at things and this is what you need. We don't have to do that. Okay? They are sold before they even come in. But here's the thing. That's not unique to my practice because people do the same thing in your practice. I had a lady that worked for me a while back, Michelle Reynolds, that nice marketing person. And she told me one time, she goes, Chris, do you have a dentist I could go to here in Colorado Springs? And I said, sure. And she said, a client of yours? I said, yeah, absolutely. So I sent her to Mike Shields. Some of you know Mike. He's the guy with the handlebar mustache. So she went, and I said, well, tell me what happened. Or no, well, before she even went, she told me, she says, I get so frustrated with my dentist. I said, why? Because she said, he comes in, he checks everything, and he says, yeah, everything looks good. She said, every time I drive to his office, I think, I hope he asks me about my front teeth. I hope he asks me about my front teeth. I hope he asks me about my front teeth, because I would sure like to improve and change my smile. Never asked. Everything looks fine. She went to Mike Shields, 10 grand like that. Okay? He just asked her, what would you like to do? How do you like your smile? Tell me how you'd like to improve it. Okay? $10,000. And she was so excited. She was so excited. Again, went from a dentist that said everything's fine, no money out of her pocket, to somebody that asked a simple question. And she ended up spending 10 grand. Years ago, I went to a seminar given by Ron Willingham, who's the author of Integrity Selling, which I would recommend that everybody read. Some of you have read it, I know. But I went to a 5-day seminar, and there were 25 of us. How many dentists do you suppose were in the room? Me. I was the only one. Okay? And I mean, we had the VP of sales in J.C. Penney and one of the big insurance companies. I can't remember the name of it. We had some really top dogs there. And they were there learning from Ron Willingham, the genius about selling, how to sell things. And so every day we would sit in groups of 5, okay? And we would kind of get to know each other, and every day we had to change chairs and shift, and so we got to meet basically everybody in the seminar. And every day, when we were introducing ourselves amongst the 5, they always asked me, "What are you doing here? Dentists don't sell anything." And I said, "That's why I'm here." Because dentists don't sell anything. Okay? So we sat down, and I'll never forget, I think it was day number 3, there was this lady named Clara, and she was a big wig for an insurance company. And she just kind of kept looking at me. You know, she'd give me the eye, and finally I said, I can tell you might have a question or something. She goes, "I do." She goes, "I mean, really, what do you sell?" And I said, "Well, it depends on what the patient wants." And she goes, "But how do you do that?" And she said, and I said, "Well, do you mind if I practice on you so you can kind of see what we do?" And I said to her, "You know, you have a really nice smile. How would you rate it on a scale of 1 to 10? She says, "I hate my smile." I said, "Okay, tell me more." And she goes, "My dentist comes in, he looks at my teeth and says everything's fine, and I'm out the door." I said, "Well, if you had an opportunity to improve your smile, would you do that?" And again, this lady had plenty of money. Money just wasn't an issue for her, but he did not take the time to ask her the right questions. All right? So she said, "Well, I'd like to have white and straight and all those kinds of things." And I said, "All right." She had a partial that she pulled out and showed me, you know, how that works. And I said, you guys have all had that happen. I've done dental exams on airplanes before. People say, "You're a dentist, could you come here a second?" You know, that kind of thing. But anyway, at the end of our interchange, she said to me, "Will you call my dentist?" She was from Midwest somewhere, Ohio, anyway. Somewhere in there. She said, "Will you call my dentist and tell him to ask me those questions?" Okay. So here's the deal. How many people are in your practice right now today that would buy dentistry and are maybe even wanting to buy dentistry, hoping you'll ask them the question, but you look in their mouth and you say everything's fine? Why? Because you have ownership. You think it's your responsibility to tell them, you know, what they have and what they don't have. But that really is not your responsibility. It's there, okay? Again, think about it this way. I asked yesterday, you know, when a patient calls, actually this morning too, when a patient calls, what do they ask for? Do they call and say, "You know, I really don't want anything, but I'd like to come see if you have anything on sale or that's cheap"? Okay? They don't ask. They don't do that. They say, "Can I have my teeth cleaned?" All right? That's a door that opens for them to be able to come in to your office to buy dentistry. It's a store, so to speak. That's where they get dentistry done. Okay? How many of you ever get the question from a patient, "Gee, why hasn't anybody ever talked to me like this before?" It happens, doesn't it? My last dentist I went to said everything's fine. And you look in there and think, okay, I'm not sure how that happened, but that's the case. Okay. Number 5, we ask really, really dumb questions. And then we put the patient in a position where they have to lie. All right. Do you floss? We all ask that question, right? And what does the patient say?
They lie through their teeth.
They lie through their teeth. No pun intended. All right. Yeah, they say, "Well, yeah, maybe not as much as I should, but I do floss." When was the last time you went to a dentist? That's another one. They say, well, maybe 9 months, or then the hygienist, because she has sharp things, maybe it's 15 months. And then the dentist asks for the x-rays, and they think, oh, I can't lie. And so they say it's 2 years, but then you get the x-rays, and it's been 2 or 3 years. All right? So we ask dumb questions, and we really put the patient in a position of embarrassment. Okay, we don't, hygienists, really, can you tell if a patient flosses?
Yes.
If they have roast beef between their molars from Sunday and it's Thursday, guess what? Now, why are you saying yuck? I mean, you do it every day for a living. It's your profession, okay? So don't ask dumb questions and put them in a position to lie, okay? Now, here are some questions that we sometimes ask that are prevention questions, I call it. Are you having any problems? Why would we not ask that?
Because that makes them think if they're not having any problems and they don't need to do it.
All right. In other words, the only thing that we treat are things that are problematic. Okay, and remember, dentistry is an optional service. What is your chief complaint? Same thing. Did we learn that in dental school? Absolutely. Okay? Again, it's about complaining. In other words, if it doesn't hurt and they're not complaining, they don't have any complaints, then why do it? Is anything bothering you? Kind of the same thing. Are any areas sensitive? Is anything hurt or broken? Are you having any discomfort? All of those are teaching the patient that this is what we do in this practice. We are molar mechanics, and if something's broken, we fix it. If something hurts, then we at least look at it and make a determination. All right? But I can tell you that what happens is it narrows the patient's focus big time. They might be thinking out here, bleaching, whiter teeth, better smile, and we bring them very, very quickly down to a certain situation like that. Okay? All right. Number 6, we confuse them. Notice the word we on that. Here's typically how I like to draw that out. All right. Hardest thing I do is to get this thing to work. Okay. We confuse him. And now this is typically what happens, all right? We start down, we start at X, and really we want to get to Y, which is this is where the patient buys, okay? And this is the start. And so we start talking, the dentist starts talking, okay? And we go like this, and we're talking, and we're explaining, we're educating, and there's something that happens right here. What is that? What happens right there?
They shut down.
They shut down, okay. How do you know they shut down?
Their body language.
Their body language, and they have this glassy-eyed look, okay. That's something that and what did they say? I mean, we can tell by looking, but what are some of the questions that they might ask at that point?
They don't ask questions. They usually say, well, I'll have to talk to my husband, or I'll have to talk to my wife and get back to you.
All right, so talk to spouse. And what's the spouse, what are they going to talk about specifically?
Fine.
Yeah, probably the money, okay? All right, and the spouse, I had a patient come in, it was a lady that we'd done, I think, a crown on her, something like that, or an onlay. And she came back because she had something going on with front teeth, and she had a lot of discoloration and things like that. And so I just asked her, I said, ideally, if you could, make the changes, anything you want, having an ideal smile, what would they look like? She goes, well, I'd make them white and straight. I said, all right. And we had some photos of some stuff that we'd done. I said, sort of like this? And she goes, absolutely. She said, but my husband will never let me do it. He just won't let me do it. I said, why? She said, because of the cost. And I said, all right. Well, we'd love to have him come in if you feel like that would be helpful. Now, when you offer that, how many husbands really come in?
No.
Hardly any. Now, but we at least made the offer, which is good. Well, this guy came in. All right, and he walks in, kind of greasy, you know, and he just sat back there kind of, you know, and we were looking at the photos and stuff like that. He was like totally uninterested. He said, well, why can't you just make wooden teeth like George Washington had? Maybe we could get an animal tooth and just put it in there. Or maybe take them all out. He was really helping the situation. I just wanted to shoot the guy. He was just so immature, frankly, is what it was. And his wife just kept rolling her eyes. And in my own mind, I was thinking, why on earth did you marry this guy? I mean, really? You know, were you that desperate? I mean, come on. Okay? But again, we get the questions that they want to talk to spouse. It's about money. They want to know how much will my insurance pay. Okay? But basically, from that point on, you don't get a whole lot accomplished. Why do they stop here? What's the reason that this becomes a stumbling block for them? What do they do? Or what's happened if they come to that point that they stop, they get glassy-eyed, they ask questions about money, have an excuse, reason to leave?
Too much information.
Okay, too much information, okay, exactly. And so the state of mind actually is, right here, is confusion. Patient is confused, and who's confused them? We have, okay? And the confused mind always says, no. Or I have to think about it. Okay? So if your patients are saying that to you, they stop you even before you get them finished. And anyway, this is typically what happens. We just talk, we give them too much information. We sometimes use dental terms. You know, Mrs. Jones, have you ever thought about ortho? What does the patient think ortho is? It's a birth control pill, exactly. Okay? Have you ever thought about ortho and they got 3 kids in the reception area? Okay? That really helps the situation. Okay? Or Mrs. Jones, you have perio. Looks like you got perio. Yeah. Well, Howard Ferran, and I don't quote Howard too often, but Howard Ferran said that he did a survey, and there were like 25 questions, and one of the questions was, what is perio? And then he had 4 choices. The most common answer, and I'm not joking here, the most common answer was a sexually transmitted disease. So, Mrs. Jones, you have perio. Okay. Well, so think about the terms that you use. Think about how confusing it is when you are doing the talking. The patient doesn't confuse themselves. You confuse them. So how do you get to the bind? Well, you just go like this. Again, this is education, etc. You just jump right over here and go right to that point right there. What you do is you sell the end result benefit. Okay? That's what you sell, is the end result benefit. Because isn't that what the patient wants to know? Now, they will ask you a question, which sometimes we really, really like this question, because then it gives us an opportunity to jump in both feet and do some educating, which we're all sitting there waiting to do. They'll ask something like, what is a crown? Right? Okay, so we generally have our dental assistant trained to either go on the CEREC machine or run to the laboratory and pull one out. And they hand it to the doctor. Doctor, in his or her brilliance, takes the crown off and hands it to the patient and says something like, be careful, these are very fragile. Okay? Then the patient looks at the model and looks at their tooth and asks what? Why is it so small? Are you going to do that to my tooth? And then you lie and say no. Okay? I did this in dental school and I didn't do very well in dental school. Yeah, that was funny. I mean, really, you got to give that was pretty funny. Okay? So when you talk about the end result benefit, you get yourself in trouble more than you should. All right, how do you determine what's the right thing to say? Well, it's about asking questions. Remember the 4 to 1. We speak one word, they get to speak 4. And sometimes the silence can be deafening. It really can. That's one of the hardest things, because most of us in dentistry are pretty gregarious and we like to talk and we're friendly and those kinds of things. And so if a patient pauses for a second, boom, we get to jump in and say something. All right? Sometimes we'll even ask another question. We'll say, well, Chris, you told us to ask questions. And I say, yeah, but ask them one at a time. Say, you know, what were you thinking about your smile, Ms. Jones, and what about your back teeth? Do they concern you, or is there anything else that, you know, you'd like us to address? Okay, so which one of those do I answer? Okay, talk about end result benefit. That's what you want to do, end result benefit. What would you like this to look like when we finish? Okay, what would you like this to look like when we finish? So you always talk about the end. I mean, you look at commercials on TV for weight loss programs, for example. They show the before and then they show the after. They don't show the during. They don't say you get on TV that the hamburger looks really big, but in real life it's only about this big. Okay, and you open this box and there's your food and the plate's about this big. And it looks like it's really big food. You put it in the microwave or whatever, and nobody tells you that, you know, you can have cake. Well, it doesn't have any sugar in it, but you can have it. It looks really good, okay, but they don't talk about that. Even in plastic surgery, they don't go through and say, you know, you're going to be out of commission for a while. You know, this is what's going to happen, and it's going to hurt. They don't say that. They say, wow, when we finish, your hips are going to be much smaller. Okay, now isn't that what you really want to hear? Yeah, that's what you really want to hear. It's not about how they're going to do it and the bruising and all the potential problems. You know, they talk about the end result benefit. In other words, what do you, the WIFM principle, what's in it for me? WIFM, what's in it for me? Okay. All right, so talk about the end result benefit. That's the way you just jump over all this education stuff. All right? Perio, what's wrong with my teeth? I said, well, there's a lot going on, and we can get to that a little bit later. And by the way, education can happen later. I just don't want it to happen in the very beginning. Okay? After the patient says yes, then you can do the exam. And we'll talk about that in just a little bit here. How on earth can you present dentistry without doing the exam? Well, a couple of ways to do that is just to talk big picture, talk about what they would like their teeth to be like in 20 or 30 years. Future focus, we call that. All right? Okay. Okay. Now, here's the question I have for all the dentists. I would say that most of us have gone to a CE, a lot of CE, that we haven't been able to find patients that want to do it. Anybody ever found that? Yeah, you go and you're so excited, you come back and you talk to your team, we're going to start doing this, we're going to start doing this, we're going to start doing this. And they know if they'll just be quiet for a couple of weeks, it will all go away and they'll get things back to normal. Okay? But I think most of us, want to do more or the things that we were trained to do. Again, we have a lot of training. We have a lot of, I need bigger ears. We have a lot of training from a clinical point of view. In fact, we sometimes hide behind that training. And the problem really isn't the training, it's the fact that we just, we haven't learned how to present the dentistry. Hang on, I'm going to do one other thing here. We haven't been taught to how to sell the dentistry so that we actually get to do what we were trained to do. All right? So I think that's critical and crucial for us to understand. Now, how do we do that? First of all, find out exactly what the patient wants. That's extremely critical. And you give that to them. And you say, yes, we can do that. Would you like to? As opposed to, Well, I don't know. I'll have to get some models and x-rays, and then we can talk about it, and I can show you what we're going to do. How successful are oral surgeons at selling patients on Laforts, for example?
On what?
Laforts, which is basically breaking your jaws, top or bottom, or yeah. How do they usually do that? They come in and they have the models that they've broken of the person's teeth and show them, that's what we're going to do with your mouth. Okay? Now, the orthodontist is pretty good, but the orthodontist is usually ticked off at the oral surgeon because they won't go that, and then they say, are there any other options without doing that? Well, yeah, we can make them look straight and they won't function very well. I'll go for that one. I had a guy the other day, I've never seen anything quite this way. We did some mountings on him, and his front teeth were probably 6 to 8 millimeters apart. And I couldn't believe how he had, I mean, his teeth were really worn. But I thought, how in the heck am I going to do this? And so we talked about orthodontics and breaking his jaw and all that kind of stuff. He said, I don't want to do that, not interested, doesn't make me happy. And so what I did is I asked my assistant, I said, go shave off the second molars on both the top and the bottom. And she went and did that, and guess what? Everything fell right into place. The darndest thing I've ever seen. So we're going to do some reduction onlays to see if we can't get those to come down again. But you know, that's the one case where I actually didn't really have a great answer. Other than the ortho and the surgery, he didn't want to go for that. So we're going to give it a shot and see how it goes. I'll let you know. But see, he wanted his teeth to function better. He didn't want them to continue to wear like they were. So why not give it to them? Now, I understand that if somebody asks you to do something that's unethical or is not in their best interest, that's a problem. Okay, that's a problem. I wouldn't do that. But most of the time, we can pretty well figure it out. Now, here's the fun part of this whole thing. What we want to do for them is really, like 95% of the time, the same thing that they want to do. Okay? But it's a matter of us finding out what's important to them, and you'll find that eventually you'll kind of come together like that, and you'll be on the same page. I've never had a patient that was over here and I was over here. This is what they wanted, and this is what I thought was best for them. Now, they didn't know that till the end, because really I wanted to make sure I understood exactly what it is they wanted. The people want, what do people want? What do they want? Beautiful white teeth surrounded by pink healthy gums, right? Pretty well everybody wants that. Now, we've all run into a few people that don't want that, but it doesn't happen too often. My favorite story about that was I had a lady come in that had moved from Georgia, just had an anterior bridge done, and she wasn't real crazy about it. She was an artist, and so I looked in there, and it was really probably the worst fitting thing that I've ever seen in my 30-plus years of practicing dentistry. I mean, I could literally get I don't know how it was staying on, seriously. I could literally get my Explorer up underneath there on all of the abutments, every one of them. So that's a tough conversation to have, is it not? You can say, you have a couple of choices. This is crap. Go ask for your money back. Okay, that's not really a good thing, because it's also an indictment on them, because they're the ones that chose to have that dentistry done. They're the ones that chose the dentist to do it. So this is what we did. I asked her, I said, how important is shape do you feel like in a smile? The teeth and how they fit together and how it matches your face. She goes, oh, that's really, really critical. Because again, she knew artistry. And so I handed her a mirror and I said, okay, what do you think of your teeth, the way that dentist made them? And she said, wow, it looks like they're sort of going the wrong way. Okay? I said, how would you like it if maybe I gave you something that you could take home to give you an idea of what we can make it look like? And so we did some quick mock-ups with composite, and I made it so it would kind of snap in and out. And she took it home, and showed it to her husband and came back and fell in love with it. She goes, this is just the greatest thing. I see what you're talking about. This would really be helpful. I said, okay. And guess what? I saved my tail because I didn't have to tell her that that lousy bridge was on there. Okay? Got to take it off and redo it. I can't remember. This is a pretty big case, maybe 10 grand, something like that. And so she was wonderful, and her husband would bring her. He was so attentive to her, and he wanted to make sure that she got what she wanted, etc. And so, you know, when we finished it up, I said to him, I said, hey, we need to, you know, tie you up and get you back here. And he goes, yeah, I don't go to the dentist very often. And I said, well, how would you feel about getting your teeth cleaned? He says, yeah, I would get my teeth cleaned. So he came in, had pretty bad teeth. What was my mind doing? Ka-ching. I am so offended. I am so offended. Okay? Well, that may have crossed my mind. I was thinking, how can I help this poor soul? But, so anyway, I started asking my questions. I mean, come on, I teach a seminar. I know how to do this. And so I started talking to him, and I said, you know, how do you feel about your teeth? He goes, yeah. All right, do you like them, not like them? He goes, eh. I said, well, you know, scale of 1 to 10, you know, where would you rate your teeth overall? I don't know, they're okay. And I said, all right. Do you want a professional opinion? I mean, I didn't really know where to go with that because I just kept running into dead ends. Everything I'd ask, he'd just say no or not interested or whatever. I mean, how important are your teeth? Would you like to keep them? Nah, not really. I don't really care. And I'm just going, man, Mr. Case Presentation, you are just, you know, tanking it. So anyway, I said, well, I have a legal obligation to tell you some things. And I said, I have a very mean attorney, and he has a military haircut and requires me on people that, you know, don't want dentistry that could cause problems to get a kind of a release. And he said, oh, that's fine, I'd be happy to. So I wrote in the chart, patient refuses all dental treatment, has been informed that this could cause pain, swelling, redness, bleeding, and death. And I really put that in there. And so he goes, yeah, I read it. He goes, yeah, that's fine. And he signed it. And I said, well, do you have any questions? He said, yeah. Do I have any cavities? I said, yes. And he said, how many? And I said, I don't know, too many to count. Okay. Got up and left, and he was just happy as could be. He'd gotten his teeth clean, you know, but they were bombed out. And I just thought, you know, poor guy. But I just had nowhere to go with that. And you're going to run into people like that sometimes. You're really going to do that. Another story, and it's really funny how this happened, but I had a patient who was coming in, and she was getting ready to buy a house. And we had talked about, I think, 12 units of Crown and Bridge before she came in for the appointment. And so I had the morning blocked off, and you know, we were ready to go. We had all the models and you know, the templates and all the stuff for the temporaries. We had everything ready to go. And so she comes in, and again, this is probably a couple months later. And I said to her, I said, do you remember why you're here today? And she said, yeah, I talked on the phone, and we're going to do this one right here. And I looked at my dental assistant. How did she get here? You know? I said, okay. And so I started talking. Well, you know, one of the things we talked about last time is how your bite is, and, you know, and prevent this and whatever. And I started down that road, and fortunately there was this little bird that sat on my shoulder that says, Chris, shut up. Just shut up. So I was smart enough to listen. So I just sat there and waited. She said, yeah, I just, you know, right now is a bad time for us. We're just buying a house. We're trying to get qualified. You know, I can't put anything, you know, on credit card. You know, I just now is not a good time. Let's just do the one. I said, okay. And she said, you know, it kind of would be nice, though, to get everything taken care of so I don't have to come back. I said, okay, that might work. She said, but really I need to talk to my husband. Okay. So we handed her a thing at that time, was kind of the latest technology, a cordless phone. Okay? Handed it to her and I said, I'll be back in a minute. So she called and talked to her husband about it. And she came back in and she said, well, is there anything we can do as far as not getting on a credit report? And I said, yes, we have some funding that will do that. She goes, okay, let's get it done. Whew. We saved it. But the only reason we saved it is because I shut up. Had I kept talking, she wouldn't have taken the time to listen. Okay? Yes?
Did she not prepay?
For the,
That was my question, I just wrote down. Where's that prepay?
30 years ago, we didn't know that.
Oh.
We didn't know that would work. Okay? And actually she did. Before we did the work, she paid for it. But I think she'd paid for the 1 crown. I think the day before, she'd paid for the 1 crown. But nobody informed me and didn't take time to look at the schedule and see if it was coordinated. But anyway, here's the funny part about this. My wife went to her house after it was built, and it was a husband-wife deal. And there was just the 2 of them. They didn't have any children at home or anything like that. And my wife went to the house to, what ended up happening, my older daughters, she hired to come help her with cleaning. And so they'd go over there and Charlotte would drop them off. And one day she went to the door and said, hey, do you mind if I look at your house? And she said, no. And so she came in and showed her house. And she said, if you ever move, call me because I'll buy it. Okay, now I didn't know Charlotte had this conversation. Okay, so I was doing one of these, and Charlotte called and she said, I just bought a house. And I said, well, what's wrong with the one we're living in? Doesn't have any storage. Well, let's build a storage shed. I mean, come on, let's figure this out. Well, anyway, as it turned out, we ended up buying their house. Isn't that an interesting thing? And we had no idea that that was all connected, but the one that she was trying to get pre-approved for was the house that we actually ended up buying. And we have 8 children, and so we needed lots of bedrooms. And this house with 2 of them, they had it set up so they could live on the main floor, and there are 2 other floors. And nobody ever went there. They were like brand new, so to speak. So anyway, that's kind of how that worked out. It was pretty funny. It was pretty funny. Now, one more comment about finding out what the patient wants and giving it to them. I had a patient named Nancy who was probably in her early 70s, very fit. She was very thin. You can tell she worked out and ate healthy and that kind of stuff. And so my dental assistant she wanted a second opinion, so my dental assistant went in and went through the process that we've been talking to you about. And again, we'll give you more detail, but she started out finding out what the patient wanted, and why they wanted to have it done, all those kinds of things. So anyway, the patient had a free end saddle, partial on both sides, free end saddles, and she didn't like the fact that it came out. Okay? And so my dental assistant said, have you thought about implants? And she said, that's what the last dentist said. I do not, under any circumstances, want implants. But she said, I don't want this thing to come out. Does anybody have any ideas how to do that? Get a partial not to come out without implants? I didn't. So Mr. Case presentation went in there, and I thought, well, I'll ask her, what's going on? See how we can help her. I mean, my dental assistant, she apparently blew it because, why couldn't we come up with a solution? So I went in there and started talking, Mr. Case presentation, and she says, no, I don't want implants, and yada, yada. We had all that, and I said, well, there's not anything we do, and, unless you have the implants. And I said, do you mind sharing with me why you don't want the implants? Now, you have to watch me on this. So those of you that are texting that aren't supposed to, go ahead and look up here for just a second. This is what she did. She put her hands right here, and she said, I don't want silicone in my body. Different kind of implant. But see, I responded, in my professional manner. I said, no, they're made of titanium. They won't ever, drag or drag. Whatever they do. You all know what they do. But, I said, they don't ever do that. And she goes, oh, okay. You mean you're talking in my mouth? And I said, yeah, we could do implants in her mouth. Because she says, everybody kept talking about implants. And she looked down and she thought, I thought, everything was pretty good. And so I said, no, all right. Okay, did we listen? Probably not well enough. Did we ask the right questions? Probably not. Until the end, I was just trying to push and say, okay, you know, I need to understand this a little bit. Okay? Now, that's a funny story. I got some minor laughs, but that was really a funny story. I mean, if that happened in your office, would you laugh about it? Yeah, it was kind of an interesting deal. However, Nancy didn't come back, and that's the bad news about the whole thing. All right. We're going to take a break. About 10 or 15 minutes, and we'll see you back in a little bit.